ONA members have heeded the call to fight for quality patient care. In increasing numbers, ONA locals are organizing events, rallies, information pickets to fight nursing cuts. As cuts are announced, locals have worked independently and through their union, informing their communities and rallying public support for quality patient care. ONA members from London, Peterborough and Toronto have been front and centre in the Visitors Gallery at Queen's Park on several occasions to witness the government's response to opposition party questions on nursing cuts.
Nurses from Peterborough are in the gallery today, Speaker. Last week they were told that their community could get by with 121 fewer nurses. Those cuts mean 250,000 hours of lost support for Peterborough families.
The situation in Peterborough is one that has been pretty serious. That's why a peer review team was sent there, led by Dan Carrier, the CEO of Southlake Regional Hospital. I'd like to take this opportunity to thank them for their work.
The fact is it's across the province, it's a virus happening, and they're cutting the nurses to balance the budgets and impacting the care that we're able to provide.
It was very disappointing. I was especially disappointed in Deb Matthews' responses to Andrea Horvath. I thought she wasn't really getting the whole impact of all of these cuts. She was mainly concerned about what they have done with the nurse practitioners, which are great, but what about the rest of the bedside nurses looking after the patients day to day?
The implications for patients of these cuts are very serious.
In London, cuts to cancer program nurses resulted in a large public outcry, a Facebook campaign and an online petition. A public open forum attracted residents, cancer patients, nurses, media and representatives from government. Dozens of citizens signed letters to government to stop nursing cuts.
You don't want to look at your daughter's face and say, "Sorry, honey, I didn't stand up." Because I don't want to have to turn around and say to her, "I'm sorry, honey, I didn't do the right thing. I'm doing the right thing, and I'm thanking all of you for also doing the right thing." Thank you.
The public support and the demonstration of their partnership with us is not a surprise to me. I am honored that the public trusts us enough now to stand beside us, and we're working on this together.
ONA members participated in a large public protest of cuts at the Royal York in Toronto. In Coburg, the Ontario Health Coalition organised a rally that shone the spotlight on threats to healthcare. ONA member Cindy Sandercock was front and centre, advocating for quality patient care.
Closing clinical services in small hospitals and closing outpatient clinics does not improve patient care when patients are forced to travel distances to access this care. This is especially problematic for emergency care, as we've seen in other communities, but also has far-reaching implications in so many other areas.
ONA members at Toronto East General Hospital took decisive action when massive RN cuts were announced. They joined nursing students and others on May Day in leafleting the community, ensuring that those who rely on the hospital for quality patient care understand what's happening to the RNs who provide that care. The community can now sign an online petition on a special ONA webpage, and members have plans to continue local action.
In Ontario, we have...
And when a new report called for bed closures and dozens of RN cuts, nurses at Peterborough Regional Health Centre took action. The group leafleted residents at Peterborough's Farmers Market early on a Saturday morning, urging them to send a message to their MPP and to the hospital's CEO to stop plans to slash patient care. The nurses continue to participate in rallies, leafleting and protest efforts to draw attention to the seriousness of the cuts.
Even here today, everybody's saying, well, we're in support of you. What can we do? So this is what we're telling them today, then what they can do, because ONA has set up the website ona.org/PRHC, where they can go online. We're giving out pamphlets, postcards today that they mail to Premier Dalton McGuinty and sign to about threatening to cut the healthcare system. So everyone is supportive. We haven't had one person that isn't supportive.
ONA members have the power to make a difference, to advocate for quality patient care, and to ensure that their community is on side. RNs continue to be in the top 3 most respected professions, and working with ONA to fight the cuts is proving to be an effective way to preserve patient care. Your provincial leaders will continue to support in every possible way these successful local events and actions. Working provincially and locally, we are getting the message out that patients need our care and the nursing cuts must stop.